Hi everyone, in this video I will be demonstrating how to properly use a UNC12 probe on a typodon. I will be covering the parts of the instruments, its indications and contradictions, the proper grasp, angulations, working order, and probing technique. Let's get started. Working end to measure the pocket depths. It has a millimeter marking from 1 to 12 millimeters with black bands at 4 to 5 millimeters, 9-10 millimeters, and 11-12 millimeters, making it easier to read. To read the probe, align the tip at the base of the sulcus or pocket and note where the gingival margin lines up with the markings. We use the probe to assess the depth of the gingival sulcus or periodontal pocket. Healthy sulcus depth is typically 1 to 3 millimeters, while depths greater than 4 millimeters indicate potential periodontal disease. Probing is done at every recare appointment as part of the comprehensive periodontal assessment. We avoid probing when the tooth or surrounding tissues are in distress. For example, if a patient has an abscess or an active infection, if there is recent surgery or trauma to the gingiva, if excessive bleeding is present without a clear cause. Probing should be done with light pressure to avoid discomfort or trauma to sensitive tissues. Each tooth is divided into 6 areas for probing: mesiobuccal, midbuccal, distal buccal, midlingual, and distolingual. We always record the deepest probing depth in each area. Hold the probe using a modified pen grasp with light pressure to maintain control precision. The fulcrum should be placed close to the working area to ensure stability. The pressure should be very light. On a live patient, you will see tissue blanching when you reach the junctional epithelium. The probe should always be angled towards the apex of the root. Tilt the probe slightly away from the tooth to angle it correctly into the sulcus. When probing interproximally, tilt the probe 10 to 15 degrees into the coal space to get an accurate reading. The probe must be adapted to the tooth surface at all times, ensuring the tip stays in contact with the root. The probe is moved in a walking stroke with small 1 millimeter increments, keeping it inside the sulcus or pocket. We avoid dragging or pulling the probe out between readings. We will now probe in the correct working order. So we would start off number 1, upper right. It's the maxillary right buccal. Get the reading for the distal buccal. Tilt it for the sulcus. And we would do that for going around the whole mouth, ending at 16 over here. Angle the probe. Angle the probe. After we completed the buccal, we will now go to the lingual. We would continue that till we get back to the first tooth. Then it would be the mandibular left buccal, starting at 17, going all around on the buccal surfaces. And then mandibular right lingual. So for each tooth, I will probe 6 sites and note the deepest pocket depth. This concludes my demonstration for the UNC 12 probe. We covered its parts, indications, and contradictions, proper grasp, angulation, working order, and probing techniques. Remember to always probe with light pressure and maintain proper adaptation, and follow the correct working order. Thank you for watching, and I hope this demonstration was helpful.